When should a BDS person or when should a MDS person should he start a clinic?
See, let's put that into two perspectives.
Where exactly should he start a practice? Hi, welcome to Confidence Speaks. This is a YouTube channel which is dedicated for the healthcare professionals. So when I say healthcare professionals, not only doctors, we are also going to concentrate on doctors, dentists, medical professionals who are working inside the hospital, nurses, everyone who's related to the healthcare fraternity. We are going to bring in experts inside this particular each and every field, and we are going to talk to them about their expertise so that adds value in their respective field. So today we are going to have Dr. Sendhilnathan with us. He has more than about 25 years of experience in the dental industry, and he basically specializes in dental implants. As of my knowledge, he's one of the best dental implants doctors in Tamil Nadu, and we are going to share more experiences with him. So now we are going to meet Dr. Sendhilnathan. Hi, doctor. How are you? It's a pleasure to have you on the show.
Thank you. Thank you for the wonderful introduction.
Okay.
So, why this Confidence Speaks?
See, the Confidence Speak, the whole YouTube channel is, I've been in the healthcare industry for the last 15 years now. I speak to a lot of doctors, a lot of other professionals. I don't see a dedicated channel which is concentrating on the healthcare professionals, how to do their whole market, how to increase their skill set, and how to enhance the whole, how do they do the practice basically, how to improve their practice, how to, how to get more patients, how to get more awareness outside. So all those things are lagging with the healthcare industry. So I see there is a lot of space here where we can, where this YouTube channel will add more value to them. When experts like you will come in and add more content, it will also help other people who are following your footsteps and take your things forward. So that's the whole thing.
Okay. That's nice of you.
Thank you.
When I heard this from you,
Yeah.
I thought, let's do it.
Okay.
Let's see how it goes.
Let's see. Okay. So my first thing is I just want to know when should a BDS person or when should a MDS person should he start a clinic? Should he start once he finishes his degree, or should he go in and work somewhere and then start a whole practice? When is the right time for him to start a new clinic?
Exactly. That's a wonderful thing to start with. See, let's put that into two perspectives. That is, BDS graduates and MDS graduates are not same. So let's see what is a BDS graduate can do. See, this is where the quality of education comes. If you're from a good institute, okay, where your skill sets are really good after completing your BDS, which is the case for most of the dental colleges. If that is the case, I think you can go ahead and start your practice. If the education part is lagging behind or you are lagging behind, let's be honest about our skill sets. Okay. If you're good in your skill sets, I think you can start as a MDS. When it comes to MDS, obviously you have spent your time in 5 years as an undergraduate and you have specifically read about and trained in some of the specialized areas like your dental implants or root canals or restorative or perio or pedo. You can straight away start your practice. I don't think there is a need for it. So suppose if you want other skill sets, suppose you are a MDS, was about to start a practice, but unfortunately in the industry, they don't recognize you for your specialization. They recognize you as a general dentist. Suppose if I am unable to extract a simple extraction, then I need to improve on that particular skill sets. That is when either you have to work under somebody or get the knowledge from somebody or attend some of the courses, then you can start. Again, having said that, where are you going to practice? Where are you going to start the practice also makes a lot of information about when do we start the practice.
That was my next question. So where exactly should you start a practice? Is there a process? Can you explain the step-by-step process of starting a new clinic?
See, exactly. See, I would rather say wherever is your roots. When I say roots, see, there should be somebody to tell your name, right? Or just because you are starting a clinic, patients are not going to come into the practice. See, somebody has to refer you, or you will have your father and mother, or some of your friend circle. Those are all the people, those who will be referring you the cases. So I would say the place where you have maximum support for yourself should be the place where you can start your practice.
So, is the location of the practice very important? So, if it's even if you're, for example, your roots from Trichy, so is there any location in that particular part, Trichy or any other town or Chennai? Is the location is very important in studying clinic. Which part of the location should he start interior of the Trichy, or he wants to go to the suburbans? Where exactly he needs to start a clinic?
See, when we started our practice, invariably, if you go to any place where you will find a dental clinic, is basically there will be a bus stand or a bus stop. Right next to the bus stand will be the clinics. Gone are those days. Today, I can see a lot of shift. The shift in the sense, what the patient prefers today is they don't want to be seen that they are going to a dental. Secondly, and they want some comfort. That is, if I am residing in a good locality, why not try a dentist who is right next to me? That's all. So instead of previous generation people where they are going to set up in a highly crowded area, now slowly they are moving towards more localized. So where there are more of settlements, wherever there is a good settlement area, that is the best location today.
Should we also consider the number of clinics in that particular location? If yes, what is the circumference? For example, if it is in and around 5 kilometers, this is the population. This is the number of dentists. Is there any set numbers for it so that for him to take or him or her to start a clinic?
That's a very nice question. Let's put this into perspective. See, today I wanted to start a practice, say in Chennai or in any of the localities. See, the first thing which I would recommend people to do is it is far more easier today with Google, right? We can take the survey of the number of people in that locality. That is number one. Second is, what is the per capita income of that particular locality? See, all these information are there. Only thing is we need to see the information that is not there is how many dentists are there in that locality. That we need to manually do a little bit of search. See, say if you're saying Trichy, see how many are there in the area that you are proposed to start a clinic. So that should be the first thing. That is the area, the amount of people in that area, and then how much is the per capita, and then how many dentists are there. This is the basic requirement. Based on that, you can decide whether to go ahead or not. I would rather say it's hard to find a place where there is no dentist to start a dental practice. So you will be starting in a place which already has some dentists. But doesn't mean that's why I said you should have some support system. You start in a area where you have support system.
Okay. So once he chooses a place, like an area, so to start a dental clinic, what are the next steps that he needs to go through? Is there any government regulations that he goes through, or what are the steps that he wants to make sure in choosing the right place for his place? For example, how much parking should he have? How much of space square feet does it need to open a small or medium? You can give me an idea of a startup or a mediocre or a high-end practice. So I don't think so the startup will go for a high-end practice. So if it's small and medium-sized practices, what is the size requirement that is minimum needed for a clinic?
See, basically, the space requirement is what you are asking.
Yeah, exactly.
So, space requirement, see, suppose if I am starting a practice today, I am a newcomer. and BDS graduate or MDS graduate. See, my minimum requirement is 2 chairs. Okay. See, why 2 dental chairs are basically today none of the people wants to wait. So basically, to have 2 chairs, even though you are the only operator, it adds value to your practice. So start with 2 chairs. When it comes to space requirement, okay. So basically, what we see is 100 square feet for a single chair in this good account. That means if you are going for 2 chair, 200 square feet is good enough. But is that all? No. You need one more 50 to 60 square feet for um, sterilization, and another 50, 60 for at least you should have a good toilet for the patient, and another 100 square feet for a reception. That means around 300 to 400 square feet is the basic requirement today. Okay. Apart from that, there are some regulations today. See, previously there was not much of. Today, the government has Clinical Establishment Act. That means you have to register your practice in clinical establishment act. Today, that is possible online itself. So you have to go to our government website and you can register yourself as a individual practitioner. So there are some requirements there. Again, as I said, this the 100 square feet is one. They are also there putting down.
Okay. So another question which I want to ask is, I'm just brainstorming with you. See, if just in case if there is a clinic for sale, for some reason or not, someone left a clinic and this clinic is for sale, and if it suits his requirement or her requirement, what are the criteria that a person should basically look into that particular clinic before going in and purchasing it? And again, the follow-up question: if he's starting a new clinic, should he buy everything from the start to end? For example, the chair cost is very expensive. Can he go ahead and second-hand chairs? Is he okay to buy a second-hand chairs? Or any other cost cutting that we can do that, or I don't advise on second-hand chairs or something. What is your point of view?
So let's put this question into 2 parts. This part 1 is, can I start my own practice or can I get somebody else practice which they are about to close? Okay. Obviously, there are advantages of going ahead with the established practice. See, the establishment cost is very less. That means day one, you'll get some patients and you don't have to do any brainstorming. Already somebody is done and it is functioning well. Go ahead. Suppose there are some downside also. If the existing practitioner is not doing well, okay, that means their liabilities, their patient liabilities are also part of yours. So that we need to be a little careful. Other than that, a good running practice, nobody is going to sell you sweat. I understand.
So how do we basically, is there any ways where we can understand how was the clinic being performed when you buy a new clinic? I'm curious about.
It's very, very easy today. Today, I think the world is really small. The dentist world is.
Okay.
And that's why your seniors or your juniors or, well, if you ask somebody in that locality, they will definitely say how good the practice is or how bad the practice is. But suppose if that person is having some digital records of how many patients that they are seeing, I think that will be a great idea. The second question that you asked in that thing is, can we cut the cost by getting some second-hand stuff?
Yeah.
I would rather say don't do it.
Okay.
Okay. See, you are starting a practice. It is better you start with a new chair, and that's a selling point also. How good the chair is a big selling point for the patient.
Exactly.
So I don't think you can cut cost on that. And moreover, the used chair comes with some kind of recurring expenses. See, suppose if you're in Chennai, you will be always getting a people to service. But in rural areas, where a tier 2 city or a tier 3 city, where you are unable to find a person to service the chair, that means you're going to lose some on that. That's why I would rather say go for a good chair. And if you are setting up, good enough. somebody else selling you a good practice with some margin, go for it.
Good. So again, so coming back, so when a person is basically starting in your clinic, um, I'm sure that he definitely needs to have the skill set in dentistry. Other than that, what are the other skill sets that he needs to develop to run a whole clinic? Because once you open a clinic, he literally becomes a small startup. He is an entrepreneur now. So what are the skill sets that he needs to run the whole practices?
That's a very important question because unfortunately, we have been taught about how to do dentistry. In simple words, how to fill a cavity, we know. How to pull out a teeth, we know.
Okay.
How do we communicate?
Yeah.
So basically, the patient rates you, whether you like it or not. We have been rated every now and then.
Yeah, exactly.
Okay. So every now and then when they are rating, the first thing that comes in the patient's point of view is how you talk. See? So communication skill has to be, and knowing the language. See, most of the time we will be using some of the terms which are medically oriented terms. Most of the time patient doesn't understand what it is. See, once you start speaking in a language that the patient can understand, that's the first skill. Communication is the first skill. Second thing is, how are you going to manage your finances? Right? So finances means, as you're asking, how do we set up? Right? For that, we need some financial literacy. Say, I would rather say, how are you going to handle the finances? How are you going to get the income? How are you going to spend the income? That is the second thing. Man management is again another skill set you need to have. Whether you like it or not, you cannot run the clinic with only one hand. Okay, you should have some of your assistant, chart side assistant, and you should have people to work for you in the reception because these are different. If you're becoming a little bigger, you need people for taking accounts, bills. So there are so many, and you should also have your associates, right? Associate dentist and lab technicians, and you will be working out with so many other professionals also. So it is better that you become a better man management person. So these are all the soft skills. And today, whether you like it or not, dentistry is becoming digital. Without a knowledge about how do we operate, because I can see a lot of youngsters, they are very good in computers and to operate an account, send a mail, because all these are, as a previous generation dentists, we are unaware, and we need to improve the skills. Today, I think those are all the skills, and those are all minimum requirements, I would rather say.
Okay. So when it comes to recruiting people, is there any ways? Because if he goes there and finding a recruit, right? And see, I see the attrition rates and in receptionist or the charge analysis assistant. These are all highly skilled job, and you need to train how do you basically recruit them? And is there any ways where we can recruit these people?
Yeah, today with the invent of this websites and other things where you can post your ads. But as you said, attrition rates, that means you are going to lose people. There are agency studies there they can support for everything. That is starting from reception to taking care of the in-house cleaning process. And there are lab persons who can also come and help you out. So these are all the agencies. But as a dentist, no, we will be concentrating on getting our own persons. So those are all the other avenues. But having said that, I think with the new age people, they are finding it easier to get it from some of the other organizations which are helping in this.
Okay. So once you set up, I'm just following up the whole thing. So once you set up a clinic, how important is patient data? So is it very important to start collecting the patient data, having it every neatly written down, and or else have a software? So how important is that data, and how is it going to add value to this practice?
So basically, when I started my practice way back in 2007, see, case sheet is one area now. Or today, the digital marketing world, or where we have softwares to track the patient. Because the moment you are sending the patient appointment, their ability to understand you becomes much better. Okay. Having said that, the data as such, how many patients that you are seeing in a day, how many patients that you are seeing in a month, how many patients are coming for which kind of treatment. These are all the important set of data that you need. See, for you to become better, you need to constantly evolve yours. See, when you are getting more number of cases for root canal, can don't tell that patient that no, I am only an implantologist. You can't. So you need to understand your patient requirements are more on root canal. Then you need to invest in that particular technology and you need to equip yourself to learn more about that. So I think that should be the major area. And then where is your income coming from? And which are all the expenses that you are doing to get the patient data? Is that match? So these are all the things that I think data is the biggest thing in the today's market.
And how important is before and after pictures?
Gamma. When I say no, I'm you know myself. That is, I have been one of the person who's documenting the case from start to finish. So good documentation always helps you in retaining the patient, and the good documentation always helps you in getting more number of patients. I think that is where I think you should. You can always show pictures from internet, but when the patients are seeing your one word, the level of understanding, their commitment towards you will be much better.
Okay. So when it comes to the clinic, how much equipped the clinic needs to be there? For example, does it need to have a full mount scan, or does it need to have this particular scan? What are the basic things needs to be equipped digitally for the clinic to run a smooth clinic?
Yeah. This is where, again, suppose if you are starting in a center like Chennai or any big cities, I would rather say only 2 chair and having minimum number of area is not what patient likes. Whether you like it or not, and that's how patients are. So they wanted everything in-house. So X-rays, digital X-rays, where you are able to see the X-ray immediately. So that smaller X-ray, that what we are seeing as IOPs, intraoral periapicals. The next thing that the patient expect is OPG, where you are able to see the entire. So of course it comes with the price.
Yeah.
So the third thing that we are seeing today is most of the clinics are equipped with CBCT today. I don't know how far it will be possible for a beginner to start with the CBCT unless otherwise he has big chunk of check ready given from somebody else or somebody is supporting him. I think that will be a nice to have. I would say minimum, not minimum thing, nice to have. And of course, there are so many softwares today, and you have even the measurements which are taken digitally today. So those are all the added advantages when it comes to practice like metro practice. Say, suppose if you're in a remote base, that is where most of the people are now growing very fastly. These things can be applied in tier 2 or tier 3 areas also. So there also. But again, it depends on your budget. But minimum requirement is intraoral IOP, chair, and a good sterilization. Of course, you should have some people to work for. God, I can see a lot of dentists starting the new practice with only them as the only person in the clinic. Those things should stop. That nobody likes because the patient doesn't want to see the doctor directly. You want one receptionist to answer the calls, to tell them what has to be done. I think those are all the minimum required. And for maximum requirement, there is no upper
limit to I understand. So again, see, another thing which I also since I've been talking with a lot of doctors, especially dentists for the past 15 years, See, I see a lot of them are focusing on one single treatment. Right now, it's been two. First one is dental implants. Second is aligners.
Okay. I just want it so much, yeah. They want it so much, and they will have their educational loans to pay. And as you said, as we were discussing so much, they would have invested. They wanted to take it out. No, okay. I wouldn't say it's bad because that is where that's where now for a new practitioner, okay, whether to give a quality treatment or cheaper treatment. See, that's where it comes. So people are thinking that they are unable to earn from extractions. They are unable to earn it from filling the tooth. So that is where there should be a change. That's where there should be a change. And I think by doing filling and by doing good extractions and doing some good period, you should be able to earn.
When you say, charging the right price, how do I choose the right price? How? Is there any other metrics that you have to choose the right price? Is it when you calculate all the overheads and then do it? Because charging the right price, I see a lot of dentists charging a very, very low price.
Viewers also.
Yeah, unappetizing as well. The reason being they are not doing a proper calculation of what is their overheads, what should be the limit. So how do we basically give a right pricing? Then usually what they do is they compare with other people and then price that. Right?
Yeah, I'm coming here. See, when you select a price, see, my own friends thinks, how they think is, when you charge, see, basically, it's about the material. Okay? It's about the material. How much is the cost of the material? That is the only thing that you are taking. No, that's really wrong. See, there are overheads.
Exactly.
See, the place is not going to come free for you.
Exactly.
Though it's your own place, the place has its own rent, overheads like electricity, and you have some people to pay. Okay, so those are all part that is also there. Okay, so usually these overheads are calculated per hour. Okay, so suppose if a procedure gets over in 10 minutes, or some procedure that gets over in 2 hours, it's not the same. Overheads are different for a 10-minute procedure and a 2 hour.
And also the things of instruments and all the features used.
So those are all the second thing. See, part one is material expense. Second one is overheads. Third one, as you said, what are all the equipments that are required for this? Sterilization charges. Okay. And there should be another charge as a professional.
Exactly. Exactly.
Having said that, there is one more charge. Okay. What is the next thing that is going to come in the market? Okay. That means we need to educate yourself also. There should be some amount, say 10%, should be dedicated for your future upgrade. So, unfortunately, most of my colleagues, even today, they charge only for the cost of the material. And is where the problem
starts. Then it goes into a spiral. They go,
well, and they get it into then they are unable to, because the overheads are not same. 2005 overheads, the rent of the place, and today what is the rent that we are paying?
exactly.
What is the price that you are paying to acquire one candidate who can work for you?
Exactly.
It's all this. It's not the same.
I think we need to have an entire video about how to basically price your whole practice. I think that will definitely add value.
We can add more number of people also there. Yes. Yes.
Okay, Rodu. Thank you so much for attending your time. It has been a pleasure talking to you. Hope we can do more videos in the future. Definitely. Thank you so much. Thank you.
Yeah.